I love the VertiTrack. I recommend it to everybody who's got, chronic low back pain. It's just a beautiful device. It works great. And I want to get one of their cervical, the Cervical 2000, because their equipment works. And so, and I every now and then have some neck pain, and I just want to be able to do the same kind of thing: decompress, get the mobility that I want. So that's what I have to say about the VertiTrack and the Cervical 2000 from MediTrac, the company MediTrac.
It's powerful. And you mentioned consistency is key. I couldn't agree more. For those people that are going to be listening and watching, I know your story of being hunched over and not being able to move around, not being able to sleep. And it seems like the only choice is back surgery. And you're trying to avoid that. Many people listening and watching don't have that deep expertise that you have in the healthcare space. I'd love for you to elaborate a little bit on why you were so adamant that you were trying to do everything you could to avoid surgical intervention.
Well, as you I'm sure know, there's a syndrome called the failed back surgery syndrome, where the patient is blamed for a failed surgery. It's like, oh, you have back surgery syndrome. We operated on you. We opened up your back. We did whatever we did, and worked on your spine. And it didn't work because you have this syndrome, which is, obviously, when I say it this way, it sounds nonsensical. So that's a problem. And back surgeries can work for a few years really well, and then after a while, they stop working. And I can explain why that is, or one of the reasons why that is. So, the point is that, if anytime you can avoid any kind of surgery on the spine, I think we want to do that. People should want to do that. And so that's why I was trying everything I could think of in the alternative medicine space. I had developed my own techniques, which I have used with clients, several thousand clients. And even those, I couldn't use them sufficiently because I couldn't even put my body in a position that would allow me to use them, right? So, really, to have a device that you can purchase, you can use, and you can retire it and be pain-free, back pain-free, that's just remarkable. It's just so great. I'm so happy to be able to talk about it because it's been years. I mean, I've been back free of back pain for years since I used the VertiTrack. And I'm so happy that, you're interviewing me so I can share my experience with people, because this is like a no-brainer. I mean, you just got to buy this thing, use it, and then sell it to somebody else who's got the problem, or give it to somebody else if you have the resources to do that. It's really something that everybody should be looking at, because I don't know of anything else that works like this. I just don't. I've not seen it. I've seen a lot of things, and when I was going, people couldn't even get me in traction because I was hunched over. I couldn't even get on the traction table. And traction, in my opinion, has the same issue with, you can get in traction once, twice a week, and then you go back to your habits and patterns and all the repetitive movement patterns that people have, which oftentimes are dysfunctional anyway. And so then the pain comes back, and we wonder what's the matter with us? But there's nothing wrong with us. It's just an automatic pattern that somebody has that causes them to experience pain. And then it's challenging for people to deal with that, like practitioners. How does a practitioner deal with that? How does a physical therapy deal with that? And I did a clinical study comparing physical therapy to some alternative therapies. Physical therapy happened to be the least effective in terms of eliminating chronic back pain. My data showed that for chronic low back pain, physical therapy, standard run of physical therapy was only 5% effective at eliminating chronic back pain. Where some of the hands-off approaches that I did would have people eliminating their back pain at a 50% level, without even just teaching them what they needed to know and what they needed to do to, get themselves out of pain and become their own healer. So when people buy a VertiTrack, they actually are becoming their own healer. They're using a device that they themselves can use. They don't need you or me as a practitioner, maybe we can help jumpstart them, but they can use this thing and they can get themselves pain free, and then they can come see us every now and then when they feel like it. But that's it, So I mean, we know that there's how many hundreds of millions of people in the world in chronic back pain. In the United States alone, it's probably 50 to 100 million in that range that experience either intermittent or chronic back pain.
Yeah.
That's a lot of people who need help. So I acknowledge you for, helping to get the word out for this product.
Thank you so much for watching this video on the Evidence-Based Chiropractor channel. If you don't want to miss a single thing, please subscribe to our YouTube channel so you can get notifications of every video we put out, and we put out new content each and every week. So be sure to subscribe today.